When you talk to your surgeon about choices to make to choose what is the best artificial lens for you, that's a discussion that I encourage you to have with your surgeon in depth. This is because after the cataract surgery, your vision will rely on what type of artificial lens you choose for yourself. I wish cataract surgery is a magic where I can keep what you love about your vision and take away what you don't like about your vision. But in reality, cataract surgery is like a reset of your eye, where what you were able to do before with the cataract or things you were not able to do with the cataract is gone with the cataract. Everything you could do after the cataract surgery actually rely on what lens you pick as the artificial lens implant. Artificial lens does have focusing power, just like our eyes has focusing power, except different types of the artificial lens will have different features. So our native lens, without the cataract when we're younger, is able to focus up close to the middle range distance, like a TV, computer distance, and much further distance, like driving, walking, travel distance. That's the beauty of the native lens we had. But as we get older, that focusing power, together with the development of the cataract, will become more rigid and less flexible, and also create the haze that you see with the cataract. Once that's removed, now whatever lens is in the eye is going to give you the power to focus. If you choose the most basic lens, it gives you great vision, but only at one distance. As an analogy to a basic power lens, it's almost like a single vision pair of glasses. Some of you might wear glasses to see far away to drive when you're much younger. If you're myopic or nearsighted, that lens only helps you to see great for distance. It doesn't help you to read. Those of you started using bifocal in your older age has a lens where it has the top version to help you to see distance and the bottom part to help you focus to read. So that lens is a bifocal or two focusing power lens. We have intraocular lens that kind of mimics that as well. So out of the near, the middle, and far away focusing point, this lens is going to give you 2 out of the 3. Now, if you truly want the highest level of artificial lens, we also have something called a trifocal lens, where it gets all of the focusing power in one lens, from up close to computer distance to driving vision, all in one. Every type of the artificial lens is going to give you better vision at the distance it's designed to, but each has its own pros and cons. So all the details about the pros and cons, I do encourage you to do your research and also talk to your surgeon about that at the time of your discussion before the cataract surgery. You're going to get great clear vision either way. You're not compromised on the quality of the vision at the distance you choose, but what you do give up from the basic to the upgrades are convenience, how much glasses you're going to wear, either full-time still with a different prescription than before your cataract surgery, or no glasses at all. So there's a range of convenience that you could pick. I also like to point out, especially as a glaucoma cataract surgeon, I also take care of a lot of patients with both glaucoma and cataract, and maybe they have other eye conditions like macular degeneration or astigmatism and things like that. Sometimes we're unable to use any of these traditional artificial lenses to get you to see the perfect level you want because of the other eye diseases you may have. So again, that's another discussion we need to have with the surgeon beforehand to make sure we rule out any other underlying eye conditions you may have that may preclude you from choosing some of the upgrades. But one type of artificial lens, which is a newer development called the light adjustable lens, is the only lens that gives us the possibility to make sure we can adjust the focusing power of the lens to your liking after the fact of the surgery. If, say, you did the traditional type of lenses, you wanted to switch to a different focusing power because you regret what you chose, that's possible, but with only to go to the operating room again and have a surgery to swap out the old lens and put in a new artificial lens. But if you choose the adjustable lens, that gives you the opportunity to do the adjustment after the surgery without going back to the surgical center, but do the adjustment in an office setting. So I encourage you, if you have other eye conditions at the same time, to also bring that up with your surgeon at the time of the consultation to see if that's a good fit for you.